and the things that she is noticing in the mirror, it helps to lighten the load of what she sees in the mirror, because she had a history of surgical intervention. And I think that was one of my most challenging, as well as understanding her history and the psychological issues that she had in order to begin to work through some of the things that she was seeing in the mirror.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners
Daniel
help
Gao
their
here.
patients
I'm the host
look
of
better,
Beauty Talk,
younger,
where we
and
feature
healthier.
the top medical
Now enjoy the
practitioners
show,
in health
and here's your
beauty,
host.
both inside and out. I have Veronica Sanders of Ivy Spa Wellness with us today. Her mission is to show compassion, give care to others, and be the best advanced practice registered nurse and nurse leader that helps others to achieve successful health goals and to promote the vision and the goals of the medical practice. She is a master expert injector and trainer for Allergan, master tattoo artist and instructor since 2018, and instructor and trainer for Palomar Laser. She is also a member of the Tennessee Nurses Association, experienced plastic surgical nurse, and certified as an aesthetic nurse specialist. So Veronica, welcome. Glad to have you here.
Oh, thank you so much for having me.
Yes, let's dive right into it. How did you first get interested in aesthetics?
Oh my goodness. Well, this was before the time aesthetics was booming. So we were in plastic surgery, and I was first assistant to my plastic surgeon. And I went into surgery for plastic surgical procedures for 8 years. And upon that being my career goal, I thought, well, maybe some aesthetic treatments would enhance my resume. And so I started doing some laser treatments as well as chemical peels. And at that time, Botox and fillers were not on the market. And so we decided that when they would come to the market, we would gradually include them into our practice. So the surgeon was with us, who basically allowed us to come in and have a clinic designed specifically for aesthetic treatments. So we basically did like all day Botox treatments. When Botox first came on the market, we in our practice treated children with cerebral palsy to help them relax their muscles so that they would be able to function a little bit better in their normal daily living. And so we decided, well, if Botox is relaxing these muscles, then what about muscles to our forehead? And that's how our practice grew, with just a trial and error on the nurses who worked there in order for us to see whether or not the wrinkles would disappear. And so they actually worked. And then maybe a year or two later, Botox Cosmetic came to the market, and we were able to, use that and enhance our practice.
Got it. And so now, is Botox still a pretty big part of the practice, or are you starting to branch out into other services and other treatments now?
Botox is one of our main staples of the practice, but we do branch out into all areas, such as the tattooing that you talked about, because we had patients who had breast reconstruction from surgery, and therefore they lost their eyebrows and they needed enhancement to their lash line because they lost their lashes. And of course, they were interested in having their lips tattooed to enhance the color of their lips. And so that's basically how that became an area where we would offer services. So we generally see where there's a need, and then we provide that need with the services. So right now, hair replacement is real big because of the weight loss. People are noticing that their hair is thinning, and so we're doing all sorts of treatments for hair replacement.
Got it. And is there a particular treatment that's special to you?
Oh, most definitely. I would say any injectable. Right now, we are offering PRFM, which is plasma-rich fibrin matrix, and that treatment is using your platelets. And we use a dry bath to heat those platelets so that they become kind of sticky. And then those platelets will become more like a filler, a dermal filler, which we are filling in the fine lines and wrinkles to the face. And that is injectable. So I can pretty much sculpt areas, turn back the clock of time by injecting those types of fillers. So that's more of a natural route. Some people do want a more natural look to their injectable treatment. And then we also have some treatments that will give an immediate result, because with the natural platelet fillers that we use, those have to be built upon. So that's not an immediate type of result. So therefore, sometimes we will layer that on top of a dermal filler, such as the Juvederm product.
Okay. Now, you mentioned as far as people looking for a more natural look, and then you mentioned about the PRFM.
PRFM.
Now we're starting to get more into like the area of regenerative medicine, and I'm starting to see a lot more aesthetic practices incorporate regenerative medicine. So for people that don't understand what regenerative medicine is, could you explain in very simple terms to see what does regenerative medicine do, and basically how can it help you from an aesthetic perspective?
Yes. So regenerative medicine is a bioavailability product that enhances your overall aging process. So it's either going to cause you to have a internal effect to them, because we do have an IV that gives hydration, but it also feeds you the necessary nutrients to help kind of block some of those free radicals that will cause you to age from the inside. So we have what is called a fountain of youth IV. Then we also have the exosomes or peptides that we are placing topically on the skin to cause the skin to reverse the signs of aging by way of either channeling it in with microneedling or radio frequency. So that is applied. And exosomes can be bioavailable or plant derived. So, and a lot of people, there's some controversy, but at the same time, a lot of people want to have both those options available. And so we make that available for them. And then, of course, the bioavailability of your own platelets. That's a difference between a hyaluronic acid product such as the Juvederm dermal filler, as well as your platelets. Those kind of work the same way, but will help to include some type of filling to the fine lines and wrinkles. Now, sometimes we will use a technique that can create more of a smooth texture to the skin. And that technique is pretty much dependent upon the technician, such as myself. I have 29 years experience. And so therefore, my technique will kind of improve your skin texture, because I know how to break up some of the adhesions that's underneath the skin that is causing those wrinkles to pull into the skin. So those are some differences and different ways that we can help to reduce the signs of aging, as well as in the future as a preventative, reduce the aging process as well.
Okay. So when it comes to regenerative medicine, would you say that this is one of the top emerging treatments that you're excited about, or would you say that there's another type of emerging treatment that you really have your eye on?
So this is something that I'm excited about right now. Now, I do have my eye on some treatments, and I am reading the research studies about it as well right now, which is Ariessence. And Ariessence is the bioavailability type of treatment that can be done to help reverse the signs of aging.
So it's also a natural type of, I guess, procedure or technique?
Well, it's a bioavailability, and there may be some controversy to that, but yes, it is more of a natural technique versus anything synthetic or lab made. Yes.
Yeah, I remember years ago when people started getting into regenerative medicine, and the FDA really did not like it. But it seems like there's more and more research coming out. There's more and more practices adopting it. More and more everyday people are starting to understand, okay, this is out there. So I think the industry is going in a great direction as far as opening it up, making it more available to people in a way where it's, like you said, people are going in that natural direction. They want things that are more natural.
Yes, and giving them a choice. and two, if you inform them enough and you give them choices, then it's up to them whether or not they can make that choice and whether or not they have done their research to say, okay, I think that this is something that I'll be willing to try.
Okay. Now, Veronica, I want to dive a little bit deeper into your practice. Like, how do you differentiate your practice from others in the industry?
Of course, my practice has been a long stay because I have 29 years experience. I think that sets me apart most certainly. And I've seen things grow and I know what works and what doesn't work. Also, too, I have a team of people here that also help me in being able to provide those services. And I train them firsthand. So therefore, they're able to, be able to draw from my experience as well as create an environment for us all so that we can all work together as a team.
Got it. And when it comes to your patients, how do you approach educating your patients about what you do, the services you offer, and the benefits?
Oh, most definitely through my assessment, as well as when I am reviewing their medical history, because, your medical history can tell you a lot about a person. And when you are discussing their health, their nutrition, their exercise routine, their lifestyle, that's your connection right there. Then it's also going to give you a peek into how healthy they are, as well as how they're caring for themselves. And it's going to let you know whether or not they're going to be committed to the services that you are recommending for them. And then I also set a treatment plan. And that treatment plan is going to give them an idea as to how often they should come in, what's their next step, and also to how much it will cost for them.
Okay. Now, I'm sure you get a lot of misconceptions from your patients coming in looking for treatment. I'm sure some come in saying that, oh, I want this, when in reality they need something else, or some people believe something one way or another about a treatment that's just not true. What are some common misconceptions that you've heard about from your patients about the treatment you provide?
Oh, most certainly. It's going to make me look different, or I'm going to look overfilled, or I will have something move around in my face. And that is most certainly not the case. And I think for me, the challenge is to educate them on how the product works. I am very conservative. I'm an individual who wants you to look like you, but just well rested, and that you will see some results, but other people will go, you look refreshed. You look like you've been on vacation for a while, or you've had a long nap. So people will notice a change about you, but they won't notice exactly what.
Okay. And when it comes to this concept we were talking about earlier about the natural look, and we're talking about like that rested look, what do you think caused that shift? People are now wanting to have more of that natural look, or the direction of the industry of people looking for that more now? Like, what do you think started that?
I think most certainly what started that was celebrities, people who are actually on a platform that we are looking at. Most certainly, they're going to set the example. And sometimes that example may not be perfect for you, and it may not set a goal for your body or for your face and your anti-aging or your budget. So, a lot of times when we are looking at maybe a celebrity who has had some treatments done, that may not be a great option for you. So say, for instance, a facelift versus having an injectable treatment done, because what you may be seeing in the mirror may exactly be something that's very minor. It may not need an invasive procedure, because many times I get women that come in and they pull back on the side of their face and go, I think I might need a facelift. And I say, well, why do you think that you need a facelift? Because I feel like my face is falling. Well, if you have, say, maybe a thread lift, or you have a filler put in place, some of the fillers, the dermal fillers like hyaluronic acid, do lift the skin. And so there may be an opportunity for you to be educated enough to try that before resorting to surgery. I think most times surgery should be considered as a last resort, where a lot of people think that surgery should be their first resort. But the risk would outweigh the benefits, because you don't need that type of treatment if it's just a minor procedure that could be done in order for you to take care of the actual issue.
Okay. And I'm sure you get people coming in with pictures from Instagram or Facebook and be like, I want to look like this. And they're using filters and all that. So how do you let them down gently of bringing them back to reality when they come in and they give you these examples of, oh, I want to look like this model on Instagram? Like, how do you kind of let them down easily and explain to them what's realistic and what's a good fit for them?
Yes, most certainly we take photographs. And when we take photographs, the photographs do not lie. Mm-hmm. So, of course, I point out some things, and of course, I tell them, what can be done, what's beautiful about them, and then also let them know that most of the treatments that someone else has had done, we don't know. And so therefore, I can only work with what is in front of me. And when your pictures are taken, we review those. And then after the treatment that I perform for them, we review that and put those side by side. Mm-hmm. So I think, reviewing pictures and then also informing them of, how beautiful they are and who they are affirms what we can achieve with what we have.
Okay. Now, how do you balance between providing that relaxing experience for your patients, but also at the same time, making sure that their safety is also being taken into account?
Oh, most definitely. I think here at Ivy Spa and Wellness, we go above and beyond because we are educating. We also talk about the risk. We also discuss with them the post-treatment so that they can, understand what needs to be done prior to having the treatment done. And then we also discuss with them their health issues because this is a long-term relationship. It's not something like a one and done. We do want to develop a relationship with our patients to have, open communication, to inform them of their treatment, the plan, the necessary care, as well as following up with them, making sure that everything has responded as we discussed. Also to making sure that they are aware of what will cause some adverse events. We also talk about those adverse events prior to them even signing the consent form. And so, we hold our patients' hand very closely with all of the procedures in order to ensure safety. And we remind them if there is anything that's going on, you have our phone number, our cell phone number, and our medical director. We do have a medical director here in Tennessee. We are required to have that. And so therefore, he is on standby at any time to make sure that our patients are being cared for in a safe manner.
Got it. Now, I want to ask you a little bit more of a, maybe not personal question, but what role do you believe creativity plays in how you approach patient care? Because many people look at medicine as, oh, it's a science, you have to follow the step-by-step protocol. But what role do you believe creativity has in what you do?
Oh, yes, for sure. Creativity has a huge role to play. I view it as art. I do think that you have to have an eye for art. And what is the golden rule for aesthetics and for the face? So the face, of course, has different frames. There is a framework that we as aesthetic nurses, we design the face around that. So when we do our assessment, we are looking at these three frames, the upper, the middle, and the lower part of the face in order to determine how that is aesthetically pleasing And that has been determined by Da Vinci. He was the father of aesthetics, so to speak. He created the golden rule. And so that's what we follow. I follow that since I've been a plastic surgical nurse since 1996. So, that is part of what we do in our assessment when we're having you make facial expressions, when we take our plastic surgical standard photos, when we're having you animate in those photos, we are looking at your upper part of your face, your middle part of your face, and your lower part of your face to see if they are symmetrical and how we can balance that out in order for you to improve those areas. And that is a form of art. And so when we look at, art form, of course, beauty is in the eye of the beholder. And so everyone has beauty about them. And so enhancing all of those areas, I think can help a nurse who is in aesthetic to grow their practice, because they're going to see most of their patients are going to look and improve their beauty and their look. And if they're happy with what they see in the mirror and get those happy emotions, then they will most likely return to see you when that's starting to wear off.
So, Veronica, would you consider yourself to be more of an artist or more of a scientist?
I think I'm a little bit of both, because, as a nurse, of course, we have our science that we base our treatment plan on, because we have to know that we know what product to use and how that product works. Also how the body is going to respond. But at the same time, we are looking at how that product can actually work with the body in order for us to achieve the necessary outcome that we need in order to see the results. And so it's the outcomes that we are looking for, but we know that the science is there in order to make that happen. So they work together.
Got it. Now, Veronica, over all your years of experience, I'm sure that you've probably run across some very challenging cases that you've worked on. So would you mind sharing maybe just one story of a tough case or a memorable case that you worked on, like a patient, and how you were able to get them a successful outcome in the end?
Oh, most definitely. I think, one of my patients who stands out to me the most, she was a 60-year-old female who had anorexia and bulimia since she was 16. And for me to hold her hand for the past 10 years has really been challenging, but at the same time rewarding, because I have helped her to come to understand that she is beautiful. And as we continue to work on her goals and the things that she is noticing in the mirror, it helps to lighten the load of what she sees in the mirror, because she had a history of surgical intervention as well as aesthetic types of treatments when she came to see me. And so she didn't have teeth. Because of the anorexia and bulimia, she lost her teeth. So therefore, she was in the process of getting implants. Well, come to find out, she was unable to get the implants because she was allergic to the material that they were using. So therefore, she needed some support for her mouth area. And of course, wearing dentures was not something that she wanted to do, but we continued to discuss how we could actually enhance that. And of course, giving her some dermal filler, such as the Juvederm product, to that area, we were able to build up enough support so that, she could see the improvement to her mouth area. Mm-hmm. And I think that was one of my most challenging, as well as understanding her history and the psychological issues that she had in order to begin to work through some of the things that she was seeing in the mirror.
I think it's a great story you told there, for what the main reason where I think most people, like your average consumer, thinks about the aesthetic industry as just about vanity. But
Right.
when I asked this question to all the practitioners, like, what's the most memorable story? Almost without exception, they tell a story of someone who just wanted to feel normal. Someone,
Right.
it wasn't about them being vain, it's just they just wanted to feel normal. They wanted to get back to just feeling like a regular human being. And I think that's one piece that people just don't realize about the aesthetic industry. It's not about trying to look like a model. It's just you just want to feel like your best self. And I think that's what people miss.
Yes.
So now, Veronica, where do you think the future of aesthetics is going?
I think the future of aesthetics is going probably with more so topical treatments. And the reason why I say that is because when we are looking at exosomes and how they're actually working, I think it's causing it to work with your DNA. And so I think we'll see more topical treatments to be able to do the work of maybe say Botox or dermal fillers, maybe even some of the laser treatments, just because it's easy to apply. And they may be applied in the medical practice versus at home, because I know some people do have skincare regimens. But I think for the most part, that may be it, because of course we do have the micro needling, which creates the channeling for it to get in. But I think if there is a peptide that has a certain way of opening up the channel to the skin, I do think that topically is where it's going to be. Got
it. Okay, well, Veronica, I have one last question for you, but before I ask it, I want to point people to your website at www.ivyspawellness901.com. Now, the last question is, what is the most important piece of advice you can give to someone who is thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Yes, I would say most certainly look for someone who is certified in aesthetics. So that would be a certified aesthetic nurse specialist or a plastic surgeon who is board certified, a dermatologist who is board certified. You want to look for the certification of these individuals in order to know that they have had extensive background and understanding of aesthetics. Maybe they've attended some anatomy courses, have attended some cadaver classes to know exactly what is underlying of the skin, not what's on the surface, but anatomically what is going on down to the bone, so to speak. So I would say for an individual who's looking for that, also to talk to your friends and family. They will make a referral recommendation, because if they've had a great experience, then they are going to recommend that individual in order to know that their friends and families are being cared for.
Okay, well, there you have it. Veronica sharing your expertise. So, Veronica, where can people contact you in your practice?
Oh, most definitely at Ivy Spa and Wellness. And our website is ivyspaandwellness901.com. Or you can reach us by 901-664-3717 here in Memphis, Tennessee.
Great. Well, thanks for being on the show and sharing your message.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.